right, so let's start anyways. No point in taking more time here. So, I'll introduce myself very briefly, and then I would like, because I'm taking over from Leo's done all of them so far. Is that right? Yeah? So I just want to kind of check in and see how the courses have been running, how he's been doing them. So my name's Dylan. I am an instructor here. I'm also the academic dean, so I oversee the diploma programs and do the curriculum development and whatnot here. And I was asked to come in to do, I think, this one and the next one, partially for a number of reasons. One, just to give a different perspective, right? Sometimes it's helpful when you're learning to differentiate and do these kinds of case studies, to have multiple ways of looking at cases. And next week, I believe we're just going to focus on the case studies themselves, which is kind of a whole other ballgame besides, learning the diseases and the patterns and treatments and whatnot. So I'm actually going to start doing that today, which is, I'm just pulling cases from other textbooks that have to do with the diseases we're looking at. And we will spend a little bit of time kind of picking apart cases from a differential diagnostic perspective. So my understanding was that we basically just go through the diseases, looking at the major patterns and the treatments for them. Is that right? I mean, we need to do some, for these guys, but I'll just say one other thing before we start here, which is that in diagnosis specifically and in pattern differentiation, a lot of it is intimately related with herbology. And what is expected is the kind of standard TCM diagnosis, which I will do my best, even if you don't understand it, I'll do my best to kind of use that as part of the way to understand the diagnosis, all right? So any questions before we start? Okay. All right, so we basically have two major sections today. So EFNT, ears, face, nose, throat section, and dermatology, which includes, or WICA includes, the anorectal disorders. So these, the ones that are listed here, there's really not very many, of the actual diseases. I mean, when I taught dermatology, I have a list of 40 diseases or something, all differentiated, that if we feel like we need more time, or need more content, we can go into more, but let's focus on the ones that are in the textbook. According to what you know about TCM so far, deafness and tinnitus. All right, what are the major TCM patterns? Immediately when we're doing internal medicine or any of these, whether it's internal medicine, dermatology, pediatrics, traumatology, the whole purpose of this is to give you the major patterns that cause that disease, right? So deafness, what are the common, without even looking at the notes, what are the common patterns that cause deafness? Anybody want to tell me?
TCM or Western perspective?
TCM.
Kidney deficiency.
Okay, what else? Right? Kidney deficiency, what else?
Liver deficiency.
Liver, yeah, that could, yeah. What else? In liver yang rising. Yeah. What else?
Dampness.
Where?
Gallbladder dampness.
Dampness or dampy?
Or dampy, yeah.
Okay. Why does that cause deafness? Sometimes.
Well, like if there's an infection,
TCM theory.
So why does the dampness cause?
Why would damp heat in the gallbladder cause deafness?
Block the temperature and then block the rising of the bacteria.
Where's the gallbladder meridian?
Yeah, it's around. Yeah.
We say that the ear is the meeting of the Shaoyang, right? So the ear, specifically, we could say the Sanjiao and gallbladder, which are both the Shaoyang meridian. So both deafness and tinnitus they're rooted in two major groups. One is the functions of the organs. Everybody said kidney, right? Kidney governs the ears. We know that old age deafness is rooted or likely related to kidney weakness. As we age and our hearing decreases, that's usually a result of kidney deficiency. Usually deafness leans towards kidney yang, but it's possible it's kidney yin. Usually kidney yin deficiency leans more towards tinnitus, right? This is a more common pattern. But the other major group is exterior patterns, right, which attack the meridians, which is why the gallbladder, we know, from our Western perspective, why would gallbladder cause deafness, right? In all many of the diseases, you have to think of it in this way, right? The function of the organs, according to TCM theory, why would that cause a specific disease? And you also have to consider the location of any of the diseases. Hemorrhoids, for example, may be related to Dumai, right? But it also related to the spleen chi sinking. Or, any of the diseases, wherever it is in the body, consider the relationship to the meridian system. That's how we look at it in TCM, right? Okay, why? Because if I treat it, right? If I treat a disease and I want to use local needles, and indeed, if you're going through these, almost every disease says, if you have blindness or an eye problem, it will list a bunch of points around the eyes. Those points might be on the stomach meridian or gallbladder meridian or urinary bladder meridian, right? So part of the disease differentiation may be related to meridians, channel theory. All right, and then so with, I guess I'll go through the notes here. With tinnitus, what are the major TCM patterns that cause tinnitus? Anybody? I know some of you already.
Excess. Could be an excess condition, could be deficiency condition.
Excess of what?
Like chi rising, or an excess of dampness.
Dampness doesn't usually cause tinnitus. It's fairly rare. That would be a non kind of standard TCM pattern. Tinnitus is mostly related to what? Okay, that's one type, and that's high or low pitch tinnitus. Mostly. Okay, what about a kidney yin deficiency?
The difference in old age.
Yeah, so kidney yang deficiencies tend to low pitch tinnitus, that kind of droning, ringing in the ears. Kidney yin deficiencies tend towards high pitch tinnitus, right? Okay. And what is the major, what's the major other organ that's often involved with that? Kidney yin deficiency with high pitched tinnitus. May also involve liver. That's another pattern, but liver yin deficiency, kidney and liver yin deficiency is often because tinnitus may be related to this uprising from the liver, right? So another pattern, the other major pattern, the excess, you said excess, right? Excess of something. Excess, the major excess pattern is liver fire or liver yang rising occasion, but usually it's a liver heat pattern, right? that stirs upwards in the liver. That's like, you know, high-pitched tinnitus, ring, maybe related to stress or, you know, something like that. Hi, long time no see.
Yeah.
Are you here today?
Yeah.
Oh, good. So far, so good? Any questions on that?
Wouldn't it also be due to an external pathogen or wind?
Yes.
Wind?
Good. Yes.
Okay.
Yeah. So we can also have acute. You know, we can. How familiar are? Did you have any kind of breakdown of the 8 principles? The yin, yang, excess, deficient.
Yeah, that's it.
Yeah.
I
I mean, did you do it in this class a little bit? You know, this is a really important. It is the most important stepping stone to correct diagnosis, which is necessary for correct treatment. So we can let's get a little bit deeper, and if we feel like we need to, you know, do a little 20-minute kind of crash course on that, we can later. So yeah, exterior wind, whether it's wind heat or just wind, can also cause acute tinnitus, right? This would be like I'll give you an example. Guy is riding his motorcycle, you know, he has his helmet on, but the wind is actually hitting. Afterwards, for 3 days, he has, you know, severe tinnitus. Okay. Clear? All right. So let's, do I put this on presentation mode or something? What do I do here? How do I do presentation mode?
Alex?
In the bottom, oh, I see, the little play thing, that one? Okay, there we go. All right, so, all right, summary of major points. All right, TE or triple energizer, Sanjiao 17, gallbladder 2.
We don't have
them yet.
Oh,
The problem is this book, it doesn't necessarily.
correlate with the PowerPoint slides?
Yeah.
Well, I have the book on PDF as well, so I can use this. Okay.
It works with one-page summary notes.
Yes.
That's the summary.
This is the summary. This is the summary notes.
There's 2 different things associated.
All right.
So the summary should
Yeah,
Here we go. All right.
That's what we have.
We'll deal with the summary notes after. Okay.
Well, don't forget that one.
Oh,
We
okay. Tell Alex.
Alex.
Okay. All right. Tinnitus, deafness, various types of auditory. Everybody knows what tinnitus and deafness are, you know, from a definition perspective, right? Causes and pathogenesis. So if you look at the first type, is basically the 8 principles diagnosis, internal or external. All right, both deafness and tinnitus could be external. Major symptoms related to exterior would be acute onset, right? Happen all of a sudden out of nowhere, usually with some kind of exposure to something on the exterior, like the example that I gave, riding the bike, wind hitting the ear, etc., etc. Internal causes may involve emotion, so anger causing tinnitus, right? That would be an internal cause. The other example, the exterior pattern would be the ear infection. That would be the Shaoyang gallbladder, damp heat in the gallbladder meridian, Sanjiao meridian, right? So other example of exterior. So wind and fire, wind and heat in the liver and gallbladder, blocking the Shaoyang. The dampness, so like this kind of infection often blocks the orifices, when we have that damp heat. It's like obstruction sometimes when we have that. And then deficiencies, we talked about kidney qi deficiency, and like I said, qi deficiency and yang deficiency will tend towards deafness in, chronic old age, slower decreased hearing loss, high pitch tinnitus, tends towards yin deficiencies, and notice the word tends towards, don't take it black and white, but it tends that way. Where low pitch tinnitus tends towards more of a qi or yang deficiency, right? Okay. All right. Any questions on the symptoms here? You know, often what we see in clinic is patients may not describe it as tinnitus. They may describe it as I have a buzzing, like sound or buzzing or white noise. Sometimes I hear patients say, it's not, they don't always describe it as a ringing in the ears, but, these mostly are all grouped into the same disease recognition here. All right.
Just ask a question. This is an area that I've had some difficulty treating. If there's nerve damage, is there any experience? Is there much success in
I have a patient who had a surgery go bad, an ear surgery. She had kind of chronic deafness or chronic loss of hearing, and then they tried to do something and damage the nerve, and she has both. She has complete deafness in one ear now, like after the surgery, and tinnitus. And the acupuncture is effective in treating the tinnitus, but I haven't been able to get any change in the deafness in that ear. I don't know if that's helpful or not.
Okay.
Yeah. I think it depends on the extent and the nature of the damage. Yeah. All right. So there's a few diagnostic notes here. Did we already go through this? We already went through this. Okay. Liver and gallbladder fire, major signs and symptoms, key signs and symptoms. Headache, right? Headache is a major sign of actually what? Liver yang rising. It's one of the first things we think of. But it may be present with liver fire as well. Flushed face, meaning a red face. Dry throat because there's fire, there's heat. Irritability because of the agitation of the heat, specifically in the liver, right? A wiry pulse, often indicates a liver pattern, okay? The pattern of phlegm heat, because there's phlegm, we often have a sensation of fullness in the chest, especially why? Because the phlegm congests in the lung, right? The lung houses the phlegm, the lung or the stomach, so we sometimes have epigastric distension as well. Usually when it's phlegm heat, it tends to be more in the lung. Copious phlegm production, all right, meaning room that we cough up. Rapid, slippery pulse. Clear? Okay.
Sorry. For liver fire and liver, these are the symptoms of the liver fire, liver not rising.
Not necessarily, yeah. These are not descriptive enough to really differentiate between the two. Headache does tend to make me think that way, right? However, we don't have enough information to differentiate between liver yang rising and liver fire here.
Yeah.
Okay.
For example, if we have these much of the symptoms, can we write the liver yang rising? Because, for example, constipation, dark flu,
Yes.
some internal
Yes. Yeah. If you have these symptoms, you could write liver yang rising.
Okay.
Yeah. Usually we don't get the flush face quite as much. And usually with liver yang rising, there's not quite as much of the irritability.
One of the things like bitter taste.
Bitter taste in the mouth with liver heat would be liver fire. The other thing is that liver yang rising almost always includes some kidney weakness with it. So, this, right? Okay.
They are not so generous to give all this
not so generous to give you all the symptoms. No, of course. That's today. Once we go through these, I'm going to put cases up, like actual, case studies, which are different than patterns, all right? Even these notes are not, they're not like comprehensive pattern listings. So, if we wanted to, we could separate liver fire from liver yawn rising. But the thing is that the treatment principles are largely the same. The major points are largely the same, with the exception, usually again in yawn rising, we have an underlying deficiency of the kidney, sometimes liver. Yeah. Okay. All right, exterior wind, major signs and symptoms. We're just highlighting these major signs and symptoms to review. Exterior pattern, chills and fever, right? What are the main signs and symptoms we look for exterior pathogens? Chills and fever plus what? Body aches, headaches, plus aversion to wind, aversion to cold, plus floating pulse, sudden onset. Okay, these, it doesn't help differentiate cold or heat, but those we always immediately want to think exterior pattern. Pattern of kidney Qi deficiency may also be accompanied by vertigo. Now, I'm going to say that, the vertigo itself, what is the vertigo when we have a kidney Qi deficiency here? It's a form of wind stirring up because of a deficiency underneath, right? If we don't have enough Qi underneath, if you guys are like completely lost, let me know, all right? If you don't have enough Qi underneath, the wind stirs up, and that's where we get the vertigo from, all right? Soreness and aching in the loins, lower back, knee joints, tiredness, weak pulse in general, or weak in the Qi position. Okay, these are all major signs that the kidney is weak. If we have liver and kidney, really this is more of a yin deficiency now, right? We would have vexing heat in the chest, palms and soles of the feet, the 5 hearts heat, night sweats, and then tinnitus, along with some of this, what we call empty heat, that is worse at night. So a lot of times patients, the tinnitus is worse when it's quiet. They're lying in bed at night and, they have this kind of tinnitus aggravated. Now, differential diagnosis, like let's look at this and make sure that we're clear. Patient comes in, chief complaint is tinnitus at night, right? They have red face, wiry pulse, red tongue with a yellow dry coating. What is the diagnosis? More liver fire. I didn't say any deficient symptoms, right? I'm only giving you 3 things, right? Like very, very few. I said wiry pulse, red tongue with a yellow coating. Yin deficiency, we would expect a peeled tongue, pulse to be thready and rapid or something like that. So, even though the tinnitus is at night, I didn't describe enough of the nature of it to indicate that it was a yin deficiency. Plus, with pattern recognition and diagnosis, remember that the tongue always shows the true state of the interior, right? If the tongue doesn't match your pattern, you're in trouble. The pulse, also, for the purpose of case studies and an exam, almost must always match. However, last year when people wrote it, they came back, they said, but they didn't give us the pulse. They didn't give us the tongue in every case. So you can't, you need to be clear on it, but you can't rely on it. You have to, most of the information, the tongue and the pulse are key, but they're also this much of that much, right? Most of the information is in the signs and symptoms.
We'll get into this afterwards, but just out of curiosity, when they're marking this, is there only one diagnosis? Like, is there one answer?
There are, because, the tricky thing is that, different people will write things in different ways. So they hire TCM professionals to mark the exams, and there's an answer, right? And then there's their ability to interpret that answer, right? So depending on what you write, like liver yang rising, liver fire, if you're what's that?
Points.
Or points, yeah. In your choosing of points is where probably the most of that gray area is. Yeah.
And we don't have a marking scheme or sort of does anybody have like an idea in terms of how the marks are distributed in terms of the answers and stuff like that, like the diagnosis with points on it?
I did have that, but I don't have it right now. Yeah, there is a marking scheme.
A grading system.
I think that's the biggest problem we're having, because we don't know.
We're kind of, we're going from blind.
It's nice to have it kind of in our mind so that we can.
This is all on it's all on the website. I mean, have you guys not gone through the case studies? Yeah, that's right. You're supposed to check it every day.
Every day.
Last time I was at the CTCMPO, they were like, they basically said, oh yeah, you want to know what to do, just check the website. I mean, that's their perspective is if they post it, it's now public and you should know it. So you should be checking it regularly. I mean, the guidelines for the exam, though, they stay the same once they're posted. So let's get a little, I want to get a little bit deeper so that I know how much play time we have to go through some of this other stuff. Next week, in fact, because I'm doing next week, maybe let's save that for next week, because I have a template that you'll use for the case studies, which will match that. Okay. Okay, where are we? Any questions on that? Major patterns? Good? Excellent. All right. Major treatment. So principal points are basically local, with the exception of the Shaoyang points. So if you notice, the 2 points listed here, the points listed here are gallbladder and Sanjiao. What points? Was Sanjiao 3 is the what? Shoestring points, right? So, the ear, because the ear is the meeting of the Shaoyang, these points are appropriate or from the perspective of channel theory rather than, the other points which are local. And, actually in almost, these are the principal points that can be used in every case of, deafness or tinnitus, and then we will add points for each individual pattern, right? So for example, I may talk differently than what's in the notes, so I may point some things out. So, what's important for your case studies is you have to be able to explain why. It's not really enough to memorize and write it down, right? So you're expected to be able to say this point because this.
Definitely smile.
What's that?
We have to write it because of this.
Because it's in my notes. I write that.
No, you have to have a reason for using those points. So these points, these first ones were, it's mouse. This group, again, it's easy, it's local. These two, it's easy. They clear the channel, or they, open the channel, right? The Shaoyang channel, which goes to the ear. When we get to liver 3, why would we use it, right? Well, we would use this in liver conditions. It soothes the liver. Yeah. So if we have liver fire, what point would we use? Liver 2. Right? Why is liver 2 better than liver 3? Because it clears heat from the liver. Liver fire is liver heat. Okay? So gallbladder 40, right? Why would we use that?
Youngness or
Gallbladder 40?
Gallbladder questions.
No, stomach 36 is not good here. No.
No,
Stomach 40 is for phlegm. No, stomach 36 is not better for phlegm. Not better than stomach 40, right? Stomach 40 is the most important point for phlegm. Gallbladder 40 because it clears the damp heat from the gallbladder channel here. Liver and gallbladder fire clears heat here. But you could use, if you're using it with gallbladder 34 is probably, 43, also clears heat here.
But this treatment is for the liver and gallbladder.
Yeah.
If it is the tonight based on the, for example, heat reduction.
We're getting there. Hang on.
Yeah, this is
Just read down a little bit more. This is all of them grouped together. This is cliff notes here.
Okay.
This is very, very short summary, right? Yeah. So stomach 40 and pericardium 8 for phlegm or heat, right? So stomach 40, most important point for phlegm. Pericardium 8, lao gong, right? What does it do? What's its main function? Clear heat from this isn't quite blood level heat. What else is related to the pericardium? That's heat. It's because phlegm heat will obstruct the pericardium. Pericardium, this is the yin spring point of the pericardium, second most distal point. So it clears heat and fire from the pericardium. This is why we're using it. And when we have phlegm heat, it obstructs in this region, right? The pericardium, chest. So heat clearing. All right. Wai Guan, Sanjiao 5, and Feng Chi, GN, I think is a typo. That should be gallbladder 20. Okay, gallbladder 20. Feng Chi, it says GN 20. It should be gallbladder 20. All right. So why do we, actually gallbladder 20 is a major point for wind, right? Feng, wind, Feng Chi. So this is also important for, these 2 points are very, I would say, for exterior patterns, right? Gallbladder 20 also clears the sense orifices. So it clears, what the eyes, ears, nose, and all types of wind conditions, we use this point. If it's exterior, we should probably use it. It also, I will add, it also does clear, quote unquote, head wind. So when we have certain types of liver yang rising with symptoms in the head, we do sometimes add this point. But, we have to ask the question, if I say list no more than 6 points that you're using for treatment, would we use this? Is this the most important point when the symptom is tinnitus? No, these are, right? That's how, you have to think, prioritizing, especially with, points like stomach 36 or gallbladder 20, if you look in the textbook, they can be used to treat 1,000 diseases, right? Everything can be treated with this. So you have to prioritize a little bit. Part of what this is about. And Li4 is another example of one of those points. Used for exterior wind, though. Okay, and then if we have kidney deficiency, major points, of course, kidney shoe points or back shoe points help tonify, and then we're using the Chi Hai or Ren 6 and kidney 6. Kidney 6 is better for yin deficiency, kidney yin deficiency, right? The master point of the yin Xiao Mai.
Still, I have a question about the kidney because if it is kidney deficiency, I'm writing it's not because of the tinnitus, because of the yang dissociation. In the kidney pattern, I prefer to use the bladder point are aside from the gallbladder. For example, I prefer to use the bladder 62 or bladder 60 instead of the gallbladder 43.
Yeah, you could do that. So in the kidney patterns, the two major patterns again, in yang deficiency, the pathomechanism is that the kidney, in yang and qi deficiency in general, is that the kidney fails to nourish the ear, right, which is a sprout of the kidney. So in deafness, right, and in tinnitus is a lack of rooting, which is similar to the high-pitched tinnitus kidney yin deficiency. It's rare that a kidney yin deficiency will cause deafness, unless it's combined with the qi or yang. The points on the Xiaoyang, right, so the gallbladder and Sanjiao here, are meant to clear the symptom that the patient is having. So the only time I probably wouldn't, because even in a deficiency deafness, there's still a benefit to nourishing. The points don't just have to clear in this case because they are shoestring points, right? So, whether maybe you choose a yuan source point instead as a nourishing or tonify the meridian would still have some benefit. Distal points on the channel of the affected symptom, right? That's why we're doing it. So, the reason we would use gallbladder rather than urinary bladder is because the urinary bladder doesn't go to the ear, and the ear is the chief complaint. When
But if you choose for example, 60 or 62, it goes from the yang,
Yang Qiaomai, 62 does. There's there's some how do we say, some variation or ability, but make sure that you're very clear on when to use that. And I probably wouldn't jump to it with deafness because it's not listed as a major symptom of a yang Qiaomai. When we talk about opening and closing the eyes or something that's more specific to a yang, because those 8 extraordinary channels have broad scope, right? So I would be simple and clear, right? It's good. All right, so just the only thing that's different here, if we have yin deficiency, kidney and liver yin deficiency, you can add the liver shoe point. Kidney 3 could be added for any type of kidney deficiency, yin or yang. Okay? Clear? Any questions on those major points? Is that enough time spent on points? Yeah? Okay. Oh, there's even an explanation in the notes. Look at that. All right, so again, dredging the qi circulation of the Xiaoyang, those distal points here, dredging the meridian. They're, again, most important with those excess patterns. Okay, we can use auricular acupuncture. All right, depends a little bit on the diagnosis. Maybe you may modify this a touch, but major points would include the heart, liver, kidney, the internal ear, and subcortex area. Okay, you can use seeds. Again, it's ear seeds are beneficial because you're, how do we say, it's a continued treatment, right? The patient can, if it's ongoing tinnitus, they can stimulate the ear seeds as you go forward, right? When they're not getting treatment, receiving treatment. Scalp acupuncture, we can use the posterior temporal line, all right? And again, the scalp method is a fairly strong treatment and frequent treatment, right?
When you say frequent,
every other day. Or every other day. I mean, you know, the scalp method is based on neurology, really, and stimulating that region of the brain. So, you know, that's why it's, you know, textbook-wise, it's meant to be stronger. I mean, a lot of patients, unless when the symptoms aren't severe, when the symptoms are severe, they're maybe willing to do that, but a lot of patients are resistant to that level of stimulation, you'll find. You can use electrical stimulation sometimes. Okay. Okay, so just a side note, you know, I'll again, the example of my patient who had a surgery, or talking about certain types of nerve damage, may not be sufficient. Most of the time with tinnitus, you can, I mean, I treated a case like yesterday where somebody, you know, immediately during the treatment, the tinnitus was gone, right? Often the tinnitus can be quickly addressed. Deafness, if it's from a deficiency, may take a longer course of treatment. You know, it may take several months before you have substantial improvement. But, you know, if you treat for a few months with tinnitus and it's not improving, yeah, they may not, right? Chronic deficiencies, right? So deficient conditions that are chronic. You know, just, this is again basic TCM treatment theory. I want to stay focused on the content, because if we get too far in that, you know, we can go a long ways in any direction here. But just basically, if any disease is caused by a deficiency, it usually takes longer to treat, because you have to shift the functions. With acupuncture, you have to shift the functions of the organs to produce more vital substances, and that takes time, right? With herbs, it also, you know, it takes more time. You have to build up the, you know, qi or yang in the body, and then that, you know, root and branch theory. Treating the root, the cause of it, the branch, the symptom, takes a little bit of time to resolve itself. It doesn't mean it always takes that long. It just means, in a general rule, it takes longer. Okay. So far, so good. All right. So wind heat. What's the major formula? First of all, actually, let me do it this way. What are no, let's not do this. It'll take too long. What's the major formula for wind heat? Are you TCMP? No, just acupuncture. Okay, just checking. Sangju Yin or Yin Chao San. Yeah, right? Yin Chao San, Sangju Yin's really mild. Yin Chao San is kind of like I usually think of that one first.
Is that what's said? I'm not that good with the words.
That's okay.
Is it in the book?
Yeah, so Sangju decoction, Sangju Yin, Sangju here is the formula that Sam mentioned, right? But actually, it shares a lot. So, you know, the classic formula, Sang Ye, Ju Hua, all right? Xingren, if there's cough, Nu Bang Zi, Fu Ping, okay, Bo He, Ma Du Ling, Lu Lu Tong, Chan Tui. Now, Chan Tui is really important for the symptoms here. The tinnitus is one of the herbs that is being added here for the tinnitus, right? And if you notice, modified, right? Okay. Some other things that we can think about, you know, changing a little bit based on signs and symptoms. So they already have Juhua. I'm not sure why they say add Juhua here. But Xia Ku Cao, if there's heat on the interior and exterior, Xia Ku Cao, especially because if there's tinnitus, you know, Xia Ku Cao goes to the liver. So we think of, again, the relationship between the gallbladder and the liver. Even if it's exterior, it has some benefit to if that heat is also affecting the interior. Juhua also, it's an exterior herb, it's cool in nature, but it has a function of soothing liver, right? Okay. So I believe this is bleeding, right? So it's bleeding of the eardrum. Okay. 吃尖子, zixia, and sung by P. Okay. Liver fire, what's the main formula? Don't read it, tell me. Major formula, liver fire, liver heat. Who else is a TCMP? Right? What's the main formula for liver heat, liver fire? I'll give you a hint. Starts with long, don. Right. Okay. I mean, this is the first thing that I think of. Long don xie tang drains fire, right? Drains the fire and damp heat actually from the liver channel. So when we have liver fire, remember it's got to be internal excess fire, right? Also remember that if in terms of formula options, remember that Longdan Xie is downward draining because its main function is clearing heat, which the action of the herbs drain downward, just like we use liver 2 with liver fire to drain down, pull that fire that's rising up into the ear, pull it downward. Okay? Do you want to go through the formula? All right. Longdan Sao and Huang Qin both drain excess heat from the liver. All right, they're cold herbs, they drain downward. Shan Zhizi clears heat from the entire interior. Okay. Chi Qianzi, okay, also clears heat. Zixie drains down through the urine. Chai Hu clears heat, soothes liver. Sheng Di cools the blood and nourishes yin a little bit. Dong Gui guides to the liver, is a blood nourishing and blood moving herb. So usually with liver heat there may be some constraint because of the function of the liver to soothe the qi. Dong Gui helps to move that a little bit. Now, Xia Ku Cao clears heat from the liver, is also very useful for nodules. So when we have things like damp heat and we have, you know, some kind of like the heavy wax buildup or something, we might use it. But normally it's used for like actual nodules in the body. No, in the body when it's heat, like stagnated heat. Right, we often use Xia Ku Cao, and specifically in the liver. Right. Yeah, if it's a heat pattern. Yeah. All right, Gan Sao, of course. All right, phlegm and fire. Major formula for phlegm. First thing you think of. So Qinglong Tang is for draining urchin tongue. I mean, it's just simple, right? Urchin tongue is the first thing for phlegm. We always, you know, because even the more specific formulas are usually like urchin tongue is the older, smaller, modular formula that some of the other formulas are kind of built off of. So urchin tongue is kind of the base, and then build from that. So, you know, Chen Pi Ban Xia, major for phlegm. Huang Qin, Huang Lian, because here it's phlegm fire, so we want to drain some of the fire down. Gualo, okay, so they're using gualo seed. We could use shi gualo, which is the whole gualo. Gualo seed is a little bit more for the constipation, lubricates the bowels a little bit. So if there is stagnation there, I'd probably use gualo shi. Dan Nanxing, along with banshao, is one of the most important herbs for phlegm, heat, and phlegm of this type. And then zhishi drains down, shi chang pu opens up the orifices, and it is used for phlegm misting the heart, especially, and kind of helps with the mind stuff. Fu ling gansa.
Is there for users some protein? Mainly or some protein is pineapple.
Usually you would use I'm going to say PC in general, not specifically PC5, because if there's a lot of heat in the notes, it says PC8, we can use Lao Gong, which is, clinically speaking, we don't often like to because it's on the palm of the hand, and so people are super sensitive to that point. We may use PC5, 6, or 7 actually is used a lot to clear heat as well. Blood stasis and qi stagnation. So when we were discussing pattern differentiation in the beginning, we didn't mention this one. Remember that blood stasis may be present in almost any disease. So even if it's not discussed as a possible cause, it is always possible. There's a saying that blood stasis is, just like we say external wind is the mother of 100 pathogenic diseases, blood stasis is the father of 1,000 internal diseases, right? Blood stasis, that's not really from the Huangdi I Ching. I just made that up on the spot. But it's true. One of my teachers said, whenever you have a bunch of symptoms that seem unrelated, look for blood stasis, because as soon as you see signs and symptoms of blood stasis, that must be resolved first. So just keep it in mind, even with other diseases, if you don't see it, even if we don't have it in the notes, blood stasis is always possible, but usually it'll be a complex, set of symptoms. All right, so tang jiao huo shui tang. Huo shui is to move the blood. This formula moves blood in the head. The symptoms are in the head. We're guiding the blood moving to the head. Okay, dong gui wei, the tails of dong gui are better for moving blood rather than the whole dong gui is better for tonifying. All right, chuan xiong is the kind of emperor herb in this case, actually, because it moves blood through the chongmai and specifically in the head area, guides up to the head. Mudan pi to cool off those warm herbs, all right, because there's nothing about heat here, so we have to make sure the blood moving herbs, a lot of the blood moving formulas, are fairly warm, a lot because the category or the flavor of herbs that disperses blood is acrid herbs, right? So acrid herbs move and disperse blood in the body. They activate the blood. You eat something spicy, your blood gets moving, right? And they're also warm in nature. So a lot of these formulas that where we don't have heat and blood stagnation, we need to use cooler herbs that guide to the blood. Mudan pi cools the blood. Chi shao both cools, nourishes, and moves the blood. All right. Hong hua, it's a safflower. When I can, I'll say the Western name if you know it. Safflower is warm again and strong moving. Dan shen is cool. All right. This again moves blood and is cool in nature. Chai hu does not move blood, but it guides to the liver. Why are we using chai hu here? Smooth the flow of qi of the liver, which will help move blood. Why else is it important here? What's the symptom? It guides to the Shaoyang. It's a guiding herb to the Shaoyang region. Just like if we had Shaoyang headache, we would use chai hu simply to guide to that region of it. So we're adding this herb not to move blood so much, although it does have the function of moving qi in the liver, but we're using it also because it's important for a guiding herb here. Shuchangpu, again, opens up the orifices. Okay, here's a nice little chart. I really don't like this thing because I like to stand back so I can see this. That's okay. All right, so when we have these ear symptoms, if they're acute, all right, some of the major ones, we think with exterior, so with infection, it means basically like an ear infection, right? We think phlegm heat or, so the terminology here, phlegm heat, right? Wind heat, okay? Attacking the exterior versus really what I'm going to say, rather than liver fire, I'm going to say damp heat in the gallbladder channel, right? So this is damp heat attacking the Shaoyang. It's not really liver fire, right? Liver fire is an interior pattern. So really where we see liver fire, and to the right here, where we have acute onset of deafness or tinnitus, specifically a key symptom when it's aggravated by stress or anger, right? So I got angry, patient comes in, I got really angry, and then afterwards I had, really severe ring in my ears. It was so bad I had to lie down, right?
Just for statistics, which one would you say is?
There's no function for statistics here. No, because you pigeonhole yourself into thinking that one is a diagnosis. Like, that's what TCM teaches you, right? That's what if you want to be a TCM practitioner, right? Not herbalist, but I mean a TCM acupuncturist, which is what you're doing, you have to not think that way.
No, I'm not saying we're going to think that. I'm just saying, in general.
There's you have to come at every case open-minded. And if I say this is more common, these are the more common ones. There's about 50 other possible patterns if you encounter them. Some of them we already mentioned, right? So it's better when we do the case studies, we'll do a few in a second. When we do the case studies, you'll see that you have to be completely objective. When you get your signs and symptoms, when they give you that case, you have to be completely objective. If you start jumping the gun right away, you're going to get yourself into trouble.
I wasn't saying for exams, I'm just saying.
In general?
An experienced practitioner, let's say, just what is it?
I can't even do that because I would say these are all very common. These are the very common ones. There's not.
That's fair.
Yeah. Like anytime somebody comes in with an ear infection, cold or flu that's affecting the ear, or even more minor patterns like where somebody has significant sore throat and it's coming up the canal. They don't quite have an ear infection yet, but they feel it going up there. It's always on this side of it. It's always the exterior, right? Whenever somebody has chronic tinnitus where it's not acute, we're always looking at these, usually related to the kidney deficiency or, kidney liver deficiency, right?
Without the background of the phlegm, is it possible to get infectious tinnitus? Because we think it's dry or heat.
It's absolutely possible. So again, I'll use a subtler example, or even with exposure to wind, we can get acute onset of tinnitus. I mean, yeah.
But for the infectious, means that there is some.
So if it's purulent, if there's like pus and discharge, YK, right? That's one of the things that we would talk about. External YK means external diseases, right? Diseases that manifest on the surface of the body. So in an ear infection, if we can see discharge, I'm using that as part of the diagnostic information. If I see discharge, that would be some component of dampness. I mean, there's some component of dampness present. So usually if we have pus or, the yellow kind of oozing discharge, that component can be considered some form of dampness. But
Right. The general symptoms is that the patient has a beginning of the disease. But then we go to the drug. We can say, for example, tinnitus due to the invasion of the or attack of the wind heat in base of the phlegm, or we can say that in attack of the wind phlegm because we don't have the wind phlegm.
okay, remember that the diagnosis is dependent on your treatment. Okay? If you're going to treat phlegm, then you can diagnose it with phlegm. If you're treating damp heat, right? If you're using a point, for example, gallbladder 34, that function is to clear damp heat from the gallbladder channel, then that is more appropriate. If your only treatment principle is to clear wind and heat, then you don't need to describe it as, damp heat. Like whatever, what is the treatment priority? If there's obstruction of fluids, loosely, right, speaking, fluids or, this kind of damp obstruction, then you should include that in the pattern, in the diagnosis. Does that answer your question? What's the question again?
My question is, when the acute symptoms,
Yes.
and it's due to the wind heat,
Yes.
and we have the symptom of the phlegm. Our pattern
Okay,
is
pause for a second. So what I just heard you say is we have wind heat and we have symptoms of phlegm. Okay, go ahead.
the pattern is the tinnitus because of the pattern of wind, because of the pattern of phlegm heat, for example, gallbladder.
Okay, there's two different things that you're talking about.
But why?
Because I can have internal phlegm, chronic, right? Spleen deficiency with, phlegm on the interior, and then get a cold or flu that causes tinnitus or deafness, wind heat.
Because
That's a complex pattern.
We can't get the phlegm from outside. Then there isn't acute phlegm pathogen. Because phlegm
Yeah, like I said,
because phlegm is not external. We can't write the damp heat because we can't write the.
Yeah, so, phlegm in this terminology, I didn't make these notes. Don't get mad at me.
No. It's just question.
I know. So, from my perspective, let's see if I can go back and find. From my perspective, it's better described as damp heat than phlegm heat because of usually we can say most. So CAM, for example, describes as damp heat obstruction, right? Or exterior damp heat in the upper jowl, right? So in CAM, are you guys familiar with CAM? I saw a book, or actually I think it's in the office, but it's that, you used to have that yellow cover. It's what all the basic acupuncture practitioners use. Chinese acupuncture, moxibustion, big yellow cover with a statue guy on the front. It's been around forever. Is that the one you're looking at right now?
Yes.
Okay. CAM, not Deadman, right? Is that CAM? Yeah, that's it. That's CAM, right? So CAM, if you look at the diagnosis and the treatment section on internal medicine for damp heat in the attacking the upper jowl, or summer heat. You know, what we learn is summer heat attack. They actually have damp heat attacking the upper jowl, and it puts this in that category. And so that's what, you know, that's the more basic perspective here, and I think that that's better terminology than phlegm heat. Yeah. Anybody confused? Good. All right. And then again, going to, you know, if the acute pattern, we're going to take a break in like 30 seconds, guys. If the acute pattern is triggered by emotional onset anger or stress, specifically anger, think about liver fire, major thing. Liver fire should also be accompanied by internal heat, strong internal heat, which would include constipation, usually fullness of the rib side, bitter taste in the mouth, thirst, right? And or liver yang rising. And, you know, in what's his Kim's H.B. Kim's handbook, he mostly he considers the liver yang rising in terms of pattern differentiation, almost always has the kidney deficiency with it. So you can kind of think of that as a helpful part of it. So you see signs of uprising of the liver, but then you also see kidney deficiency, lower back pain, frequent urination, something like that, and it's more of a yang rising pattern. Okay, but both could be related. We can get yang rising with anger and stress as well. Okay, when it's chronic, okay, kidney yang deficiency tends towards hearing loss. Kidney yin deficiency tends towards tinnitus and more high-pitched tinnitus. This could be kidney and kidney and liver yin deficiency, right? Mother-son relationship, kidney nourishing the liver. Spleen deficiency with phlegm accumulation this is internal, right, and may be related to the chronic, okay? Phlegm obstructing the orifices, yeah.
And the difference between the liver chi stagnation turn to heat and liver fire.
Okay. Liver chi stagnation turn to heat is mild heat that does not blaze upwards. So fire and this is really like getting into translation of Chinese words, right? When do we use the term fire? When do we use the term heat? I mean, in foundations, they're just grouped together, right? So they share a lot of symptoms. The term fire is usually chosen when we have two major differences. One is when it scorches the fluid. So when we have dryness, significant evaporation of fluids, which would include the constipation, yellow scanty urine, and severe thirst, right? This is when we often use the fire scorching, right? It's scorching, okay? The other major symptom is that fire rises upwards. So yes, in a general sense, heat rises upwards, but not so much in this differentiation that you're asking about. Fire, by nature, flares upwards. So when we have symptoms in the upper body and the head related to the liver, it's most often fire rather than stagnated liver heat. So liver stagnated heat is mild heat that is generated or caused by qi stagnation. And so the heat stays kind of localized to the liver area. And we may still have, mild heat symptoms in the body like thirst or something like that. Usually the tongue sides are red, where in liver fire the entire tongue is red. Usually in liver stagnated heat we have the combined liver spleen pathology, so liver overacting on the spleen, so we have mild digestive disorders, spleen deficiency symptoms, right? Where when we have liver fire, it's more common, it's an excess pattern, pure, and it more likely attacks the stomach or sometimes spleen, but we don't tend to have the more chronic spleen deficiency type pattern like teeth marks on the tongue, etc., etc. Liver fire easily causes bleeding. So, for example, coughing of blood, aggravating the I don't know if that, right? It's much more yang in nature. Okay.
And it can be said that liver stagnation turned to heat is more chronic, but fire could be acute.
Fire will often cause more severe acute symptoms, right? Like the symptoms will tend to be of acute onset. Now, liver stagnated heat, the heat does take time to generate from the stagnation, but the stagnation could be acute. Yeah, I'd say that it is a differential way of thinking about it. Okay, everybody so far so good? All right. Last little note here at the bottom. We may have systemic qi and blood deficiencies, which are usually, of course, related to the spleen. The spleen, is the mother of post-birth qi. Why? Because we get our post-birth qi from the food, right? It's food and stomach. So the spleen is often responsible for our systemic body's energy, right? And also the spleen and pancreas produce blood. So when we have a chronic spleen deficiency, we often end up having systemic weakness of blood. So if you see signs and symptoms that indicate systemic qi and blood deficiency, and we have deafness and tinnitus, you can think that that's related to the spleen weakness, which we didn't really talk about here, but that's okay. What are the major points for spleen? If I list 4 important points for systemic qi and blood deficiency related to spleen.
Spleen 6, 9. Actually,
Not 9.
20. Read the 20.
UB 20. Yeah. What else?
For spleen deficiency.
Spleen, qi deficiency with blood deficiency, both systemic, right? UB 17, Gushu, that's good. Already said spleen 6. Spleen 3, maybe. I would throw stomach 36 in that one. Yeah. Spleen 10 doesn't really nourish the blood much. It's more for moving, right? Its main functions are moving and cooling. It's not that tonifying. Doesn't have much of a tone, not too tonifying. Spleen 3 we absolutely could use here.
You say them over again?
What did I say? Spleen 6, back shu points, right? So the 2 back shu points is spleen shu, UB 20. Ge shu is UB 17. This is the influential point for blood. So what's even more important here, not only does it tonify blood or have a function, is the way that it's said to tonify blood is as the diaphragm shu, it helps communicate the energy between the spleen and the heart. Blood is produced by the spleen, but it is produced in the heart. So the spleen sends the energy from food up to the heart where the blood is produced. Goshu helps facilitate that process. So, it's a good point here. And then stomach 36, because it's a very tonifying point systemically for the body. Post-birth qi, major point. Earth point on Earth meridian, right? This whole bit. This is an example where I would say stomach 36 is important to use. Why did I say no to spleen 9? Because spleen 9 is more commonly used for dampness and for clearing dampness. So you see it empirically used for damp heat and excess damp accumulation, where we want to increase urination or drain dampness or clear dampness. from this yin area especially. Could it be used? Yeah, it's okay, but I probably wouldn't use it in clinic for that, in that way either.
Or in a clinic, I'm not forget that. Because the heart is the place that change and transform into the blood, can we use, or is it good to use, for example, heart stem?
We usually include heart points when there is a blood deficiency, but two instances that I would likely include. I mean, basically, if you have any heart symptoms, add heart points. Occasionally, when we're tonifying blood, we can add a heart point, but almost all the time, it's when we have even one heart symptom, poor memory or palpitations or whatever. Yeah, insomnia, something like once we have a heart symptom, then add a heart point as well. Okay? All right, let's take 5. We're going really slow, so. What's that? Is this helpful? Is this like, are you getting what, are you learning, or is it boring? Is this like, it's like, man, I learned this like 20 years ago. This is all boring.
It needs to be reinforced.
Yeah, that's right. It does, doesn't it? All right. So let's just take 5. All right. No pressure. 4,000 years in the next couple hours. So these are fun. Some of you guys may be familiar with these, but these are more complex case studies, but I want to use them to learn or start thinking about analyzing signs and symptoms that are not, out of the textbook. You need to be able to use this information and apply it. All right? Okay. So, sorry?
We don't have these as a handout.
No, you don't have these as a handout.
Okay.
You can take a picture if you want, but that's the best I can do. All right, so read through the case. Patient, all right, main signs and symptoms are dizziness and insomnia. All right, it already tells you that they also have low blood pressure. Patient was 47-year-old woman whose first examination, blah, 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 doesn't matter. Dizziness of the head, insomnia, and low blood pressure. What does that tell you, right? What is the likely diagnosis here? What is the likely, right, deficiency of what? Blood. Yeah, obviously. See how simple this is? It's not difficult. Okay? She's had it for 2 or 3 years. All right? It's chronic. Okay? All right. I'll go a little bit lower here. So during the period, let's just read through the information. I don't know if I want to read the whole thing out loud. Patient often suffered from dizziness of the head, insomnia, no pleasure in eating. What are you thinking in your head? Spleen deficiency. Remember what we talked about? GM blood deficiency. Scanty food intake. Dry stools with bowel movements only once every few days. Who can explain that? Fire? You think so? See, you're making too many assumptions, right? You got to be careful. Blood deficiency can also cause constipation of this type, all right? She had been to several hospitals for treatment, blah, blah, blah. Diagnosis was low blood pressure, which is quite low. Wow, 78/50. What? And they kept giving her this formula, all right? Bujang Tang is for spleen deficiency to boost and raise qi upwards. All right? What's the problem here? Why isn't she getting better? Because they're not nourishing the blood. Okay? Simultaneously. All right? This I know not all of you are doing formulas, but this formula only tonifies spleen and does not tonify blood. Even based on TCM theory, we have root and branch. even though we know the root of the blood deficiency may be related to the spleen deficiency, but to be honest, she only has poor appetite. She doesn't have some chronic, long-term spleen deficient pattern, right? So we don't, it's not really there. We need to address the acute branch, in this case, the acute symptoms of dizziness and whatnot that are caused by the blood deficiency. All right, so she also has poor shen, right? Essence, spirit, poor mental state, low energy, lack of strength, right? These are all signs of qi and blood deficiency. Also, she was agitated. Okay, so does she have liver qi stagnation? Not necessarily. Okay, don't jump the gun all the time. She was slightly undernourished. She had yellowish facial complexion without luster. That shows what? Spleen deficiency, right? Yellowish complexion. Tongue fur was normal. Tongue body was moist without abnormalities. Her speech, voice were basically normal. Pulses were slightly fine, or which is also thin, right? Fine or thin, but there were no other abnormalities. So thin pulse indicates. Good. All right. So the framework for. I'm realizing that we're not going to have time to do all the cases that I was going to do today, but next week. You can't read it?
No.
It's okay. I'll say it out loud. So it says disease. All right. So in case studies, this is what the framework was, what you're expected to do. You have to describe the disease that the patient has, right? And that's, this list of, it could be tinnitus, it could be some other disease that you're expected to identify. The pattern, the TCM pattern, which is, the TCM diagnosis, the treatment principle, right? The treatment principle in qi and blood deficiency. So what is the treatment principle for this case? And then the treatment, which are, basically what points are you using? Are you using moxa? Are you using cupping, leading? Are you using herb? We kind of group in these two major sections because you're either an acupuncturist or a TCM practitioner, and the herbs are the difference here. So if you're doing TCMP, then you would think that way. Remember that acupuncture also includes moxa use. So that may be indicated. Okay? So in this case, what's the disease is actually listed. It's quite easy, right? The disease here is dizziness, head, something like that. What is the pattern? Just blood deficiency? Just spleen qi deficiency?
Spleen qi not produce blood.
Not any deficiency.
So you have to think though here, so this is a pathomechanism, right? But it's not necessarily the diagnosis. The diagnosis is always what you're treating now, right? What are you treating now? Basically, spleen qi and blood deficiency, right? Both of these you're going to address. The blood deficiency is probably more significant, okay?
It is spleen qi deficiency or spleen qi and blood deficiency?
I'm saying spleen qi deficiency and blood deficiency. Yeah. And I'll indicate that in my treatment plan.
With the spleen qi deficiency, would you not expect more scalping of the tongue?
It's not how case studies work. It's not how real patients are. We have signs and symptoms of spleen qi deficiency. We should address it. If we have yellowish complexion, poor appetite, From my perspective, right? From my perspective, the spleen chi deficiency is very minor, but the question is, are you going to tonify the spleen? And you are, right? And that's why we're going to include it as part of the pattern. All right? Make sense? So if I'll see if I can find another marker here. Just give me 1 second. Support.
The screen. In case it's but you are managed
As long as I don't lose it. If I burn through one marker in a class, that's bad. Alright, so if we say that this is spleen chi and blood deficiency, what's the treatment plan? What are we going to do? What's the treatment principle? Sorry.
Tonify spleen. My blood. Nourish blood.
Good. Make sense? Clear as mud? Good. Treatment. What is our actual treatment plan? Yeah, what 6 points are you going to use? We kind of already did this one, right? Sorry? Stomach 36 for sure. Okay. Okay. So remember with treatment, and this is one of the things that you're seeing in these notes, root and branch, right? Address the disease. The symptoms should be addressed, as well as the root or the diagnosis, right? So, if you only do body points, systemic points, you're not really treating the patient's symptoms. And the patient's kind of like, why are you doing points in my legs? When I have dizziness or whatever, right? I understand that there's many different TCM treatment methods, and that sometimes we do use distal points, but you need to have a reason or a logic behind addressing the symptoms. This is one of, in the medical field in general, right? Any healthcare profession, you have to be kind of looking at that. Are you addressing the patient's chief complaint? What they're complaining about? Or are they coming in saying, I have a cold and flu, and you're like, well, you have kidney deficiency, so I'm going to tonify your kidneys, right? Well, that's not what I want you to treat. I have, this. Do what you can to treat that.
So would you add in like 36?
In this case? In this case?
Well, just because for the PC6 for open gates.
Why? Why would you do that here?
You'll be
Spleen 6 we could use, yeah. Question?
Would you use the open point on the vertex?
So this would be a way of, remember there's probably many points that treat, when you look in the textbook, what points treat diseases versus what a function of a point is. So
Right.
2 different categories in the textbook. That's a point that treats dizziness as a disease,
Yeah.
right? And it's helpful for raising chi, spleen chi, this kind of thing. So yes, that is a good example of a symptom, symptomatic point. So, do 20 for that function, and then I can pick, some other points. What are the other points? You said spleen 6. That's appropriate. What else? Yeah, UV 17 and 20, right? Now, I may, because of the nature of this is a little different than what we've, the conditions we've talked about, but it's similar in nature to some of the things. I just couldn't find a specific one there. So, I may, in this case, use liver 3, right? Because liver 3 nourishes the blood via the liver, and because the blood deficiency is systemic, right? Sometimes we use liver 3 for that, and because the symptoms are symptoms of dizziness, it's kind of a head thing. Even though it's not like an excess liver pattern, there's still this this is essentially wind from blood deficiency, liver blood deficiency. So that is one of the other TCM patterns. It just doesn't tend to cause tinnitus and deafness. So we don't see it here.
How about the amount of points that?
Oh, I'm not talking into the microphone. Oh, he's going to kill me. Sorry, go ahead.
The amount
Yeah,
of
read it.
points, like I know we can put a lot more points kind of thing, but what would you say is, no, for exam, like say I don't want to.
No more than 8.
More than 8?
Yeah, and I would never put more than 8 on an exam.
And how about at least 4 or 5?
They said, for example, 3.
They tell you.
Yes. 4 first point.
And
After that,
4 secondary.
Yeah, I guess that it's not more than. They are usually at 4 first point.
Yeah, 4 primary points.
4 primary.
So, you know, that's the major thing here is your ability to choose points, right? And so if you think of kind of what we're doing, it's like the guidelines for that, and again, we can talk more. We really shouldn't spend too much time because we can spend next class on this. We should get through this stuff. The principle is to make sure you're addressing root and branch, right? And make sure that your pattern differentiation is correct. And, you know, the points, basically choosing some points that address the symptoms appropriately and points that address the cause of the disease. Clear? Excellent. There's one more that I wanted to do from here. Let me just check what page that was on. 56. Is it 56? Yeah. Okay. No, these are all very, you know, it's helpful to do this no matter what you're doing. So, all right, this patient is a 31-year-old female who came from the province of Chief complaint, a roaring, booming sound of insects inside the patient's head and generalized headache for more than a year. So this does fall under that category. You know, I know we're learning tinnitus as a disease, but this will actually kind of fall into that same category in terms of pattern differentiation. She was diagnosed with Sheehan syndrome. Okay. I'm just skipping, going to the important parts. The disease was due to her postpartum condition, and the symptoms were as follows. So, you know, the fact that the onset was related to postpartum is helpful for us a little bit. Okay. The sound of insects inside her head with a booming, rumbling noise as if someone were starting an engine or running machinery. Aching pain and clouding oppression of the entire head. So what are we thinking right now? Well, it sounds like obstruction to me. Keep going forward, okay? Generalized fatigue. Taking pain meds, generalized fatigue, could only get up from bed to walk around a room, couldn't leave her house to go to the market. Whenever she had to leave her house, her entire body became powerless. She was without strength. Her legs ached so badly, she could not return home on foot. So constantly tired, weak, only wanted to sleep. Menses was very scant. So what picture do we have now of this patient? Is this an internal or an external pattern? Is it excess or deficiency? Is it hot or cold? We don't know yet. I mean, based on what we've read, we don't know for sure yet. Okay. Just checking. Okay. Her development and nutrition appeared normal. Complexion was slightly jaundiced and lacked luster and sheen. Tongue fur was thin and white. No abnormalities noted. For listening and smelling. Pulse was slightly slippery and slightly fine. This is more complex, isn't it? Okay, so this is a good example of extracting useful information. Does anybody want to take a stab at a diagnosis here? blood deficiency, you think, like the last one? Chi and blood deficiency. There may be some element to that, okay? Let's look at the symptoms that you have, all right? Slightly slippery, spleen deficiency. Slightly thin, blood deficiency, yes, all right? Jaundice, spleen deficiency, lacking luster and sheen. This is the describing the deficient Shen complexion, deficient facial complexion. Aching legs, and how did they describe clouding oppression of the entire head? To me, this sounds like some form of damp obstruction, which would be rooted in the spleen deficiency. So, as opposed to having significant blood deficiency like the last case, here we have probably some damp accumulation present, all right? And slippery pulse, unlike the last case. So, you see, well, both are Qi and blood deficiency, so how does that change our treatment? Our treatment now should focus a little bit more on spleen and moving some of the dampness, probably utilizing Sanjiao points a little bit, and maybe spleen 9 in this case, maybe. Okay. All right. So let's let's try and finish some of the other cases.
So what book is this from?
This is from a book called Jiao Case Studies of Jiao Shude. Jiao Shude. JIAOSHUDE. Sorry?
Thank you.
It's not so easy for me to write with my leash on. I have to take my leash off.
Maybe you can move the board a little closer to your stand.
It's fine. I'm realizing that we have to go through the book if we're going to finish it. So I don't have the answers here, so these are just the cases. But I can get the book. Of course. So it's a textbook. I use the cases for teaching. When we teach case studies, this is the content that we use. So, the practice of having it without the answers is actually where you learn. If you have the answers in front of you, it's still learning. But anyways, you can order the textbook. Yeah. Of course. Oh, no. That's another thing. This textbook has no acupuncture in it. It's all herbology, right? Which when we teach it, we can still go through points that would be appropriate for every case, but it emphasizes the importance of herbal understanding and diagnostic principle. Anyways, besides the point, let's move on. We'll get to some other things soon, okay? I'll pull some other cases. I'll probably just do one case per section because I think that's all I have time for. Okay, tinnitus and deafness from wind heat. We can use Yin Chao San, Man Jingzi San. Okay, Man Jingzi. Actually, this is quite good for the ear symptoms specifically with heat. That's it. That's all we have. Okay. Let me just get the next one here. What's the next section is, should I copy the wrong ones into here? Sorry, 1 second. All right, myopia. Myopia is, what is myopia? Loss of sight. Yeah. Basically, remember that there's a little bit of of space between the translated words. Sometimes the term in Chinese that is translated into myopia, traditionally in Chinese medicine, will encompass a larger range. So in the examples of a buzzing, like tinnitus, very specifically, versus a buzzing in the head, that may not be an auditory thing. Sometimes the TCM term is broader because it's older, and it was used to incorporate a wider definition of a disease. And myopia is one of those things, okay? Summary, syndrome differentiation. Do you want summary after? I forgot to do the summary of the last one, but I think that's okay. All right, so specifically myopia is inability to see objects in, basically poor eyesight. All right, poor eyesight. What are the eyes connected with? What's the first thing we think of? Liver. Liver governs the eyes. All right, and so you're thinking of all the patterns that may, go along with this. Most of the time, let's review the clinical definition here. Clinical definition is that myopia can be defined as those, with lower than -3 diopter, and above -6, all right, as having, below -3, below 6, and below and above. Shouldn't that be -6? No?
-6.
Okay, this is,
Is bigger than -6.
okay, all right. All right. Anyways, poor eyesight. Causes and pathogenesis according to TCM. Congenital defect of the primordial chi. What is the pathogenesis here? Kidney deficiency, right? Congenital chi related to kidney weakness. Kidney nourishes the liver. We have early onset childhood myopia, right? We always think congenital. The onset is very early in life, right? These, consumption of the shen, the spirit, manifests in the gaze and the eyes, okay? Liver and kidney resulting in abnormal shape of the eyeballs. Persistent incorrect use of the eyes for reading can also strain the eyes. Malnourishment of it looks like, post-heaven chi here looks like spleen, right? So this is a pattern of spleen not nourishing heart blood, it looks like, or heart yang, we'll see, yin or yang of the heart. Liver and kidney, and then this last one is strain, looks like chi and blood stagnation of the collaterals. Liver and kidney deficiency. This is farsighted, right? Cannot see normal vision on close items and cannot see items that are far, right? This is often, if there's a liver and kidney deficiency, major signs and symptoms including insomnia, if there's a yin deficiency, or blood deficiency maybe, low backache, dryness of the eyes. This would also be more of a blood deficiency associated with the liver. A red tongue is more yin deficiency. Thready pulse, more yin deficiency. Pattern of spleen, chi, heart spleen deficiency is accompanied by lassitude, poor appetite. Again, spleen, chi not nourishing heart blood. Okay, poor appetite, loose stools, dizziness and palpitations are the symptoms associated with heart blood deficiency here. A lusterless complexion, a pale and poor shen, indicates deficiency of qi and blood. With a white tongue coating, which is kind of normal actually, thready, that says thread, it should say thready pulse, indicates blood deficiency, thready pulse. Okay, could be blood or yin deficiency, here it's blood deficiency. Primary treatment, local points, all right, points around the eyes, include stomach 1 and gallbladder 1. Feng Chu, the point on the back of the head, talking about gallbladder 20. This is a major point for the sensory orifices. You'll see this chosen a lot in this kind of whole section category. Yiming, I believe is, no, that's Chuho. Where is Yiming? Which extra point is this? That's Yu Yao, that's fish waste. That's a fish waste, that's Yu Yao. Well, I don't know this point, so anyways, some of the other points that are extra points around, of course, Tai Yang, the extra point here, right? Yin Tong, okay? Yu Yao, I'm saying just the extra points around the eyes. Yu Yao, right, the fish waste, and Chu Ho, okay, that point 1/3 the distance on the outer inferior edge of the eye. So, you know, these are all extra points that we may use to try to stimulate. I'll have to look that point up, or somebody else can, better yet, while I teach. Okay, and why do we use gallbladder 37 here? Gallbladder 37 is what point? Low connecting point. Therefore, it does what? It connects to the liver meridian, right? So this is vision and a major point for improving vision in general. So we will often use this as an additional point. For extra points, if there's kidney and liver deficiency, we use back shu points. Deficiency, back shu. For the pattern of liver and kidney deficiency, for heart and spleen deficiency, we use back shu points of heart and spleen. UB 15, UB spleen is 20, right? And stomach 36, major tonifying systemic point. All right. Stomach 1, okay, local points, move qi, circulate qi in the area. GB20, crossing point of Shaoyang and Yang linking channel, Yang Wei Mai, right? Regulates qi and blood of the eyes. It's, you know, this is a big point. It has many functions, but that's an interesting and important one that we often don't think of. Yiming and Guangming are empirical points for. I'm not sure, like I said, do you have it? Do you have a
I knew this point, that's why I googled the answer.
It should be extra HN14. Somebody, if somebody else could look it up so I can keep going forward and then just fill us in after. Yeah. Okay. Acupuncture can be effective for myopia, especially for pseudomyopia. Patients should treat their eyes in a proper and healthy manner, which means lifestyle recommendations. Don't watch too much TV. Don't drive too much in the dark. It's a common cause of damage to the eyes. You know, all of these things. Don't strain the eyes if you're spending all day in the library. I often teach patients, you know, exercises or looking away and whatnot during their long periods of, you know, 9 to 5 typing, staring at a computer screen.
So,
right.
Why they choose the group 1
all the points around the eyes could be useful. All right, so I mean, if I had to theorize a time when I would choose bladder 1, I mean, bladder 1 is simply it's a major point around the eye. We use it more commonly than stomach 1. For example, it's, you know, one of the only few points that's actually in the eye socket, and it's the one that's easiest. Oh, I shouldn't say it's not really any easier, but we just often use it along with Well, usually we would only use one, but we could use both. What I would say, for me, when I would probably use it would be more in a kidney pattern, because it has that connection to the kidney channel, right?
It says that exoptosis, you make eye brightening, one shunt posterior to triple warm of 17.
Okay, so this is
14.
right.
14 or 13.
It's 14.
Okay, so that's a typo. You can correct that in
So
here.
it's supposed to be 14.
14.
Where is it? What page is that on?
18.
Oh, I should not. I should write in here.
EXTIN 14. 14.
14 and 13.
Okay, what are major herbs? This first one looks more for so opening up the orifices. All right, right. Most of these like Shi Chang Pu Yuan Zhi. Yeah, Ding Zhi Wan, modified Ding Zhi Wan. And for lack of liver and kidney deficiency, we can use the Zhu Jing Wan. All right, see the tonifying the kidney points here. I want to spend less time on this particular section. Myopia, I think, is a minor one, so I'm just going quickly. See a few other herbs added in there that help to guide to the eyes a little bit specifically. So the seeds, you see the use of chu si zi, chi qian zi, wu wei zi, right? So, basic ideas that the seeds guide to the eyes here a little bit, theoretically. Okay, another formula here for Kang Jing Tang. All right. Also for deficiency of liver and kidney. Liver stagnation. Use a Bu Qi, tonify the Qi, Huo Shui, move the blood decoction. Right, to disperse and move. This is that eye strain, myopia related to strain of the eyes. Okay. Next section is sinusitis, right? Okay, this is a little bit more important, I think. Summary we'll go back and do at the end, right? Okay, besides the summary, sinusitis, what are the things that you think of? What meridians, what region is this in the body? What region? Yang what? Yang Ming specifically. The Yang Ming, so just like the ears of the Shaoyang, we think gallbladder, gallbladder and Sanjiao meridians often. This area we want to think Yang Ming, so stomach and large intestine meridians. Okay? You'll see almost always, no matter what the cause is, what the root is, you will often see some of those points used because of the symptoms, branch and root treatment again. The other things, of course, everybody said external pathogens. So often sinusitis, rhinitis, this kind of obstruction is related to exterior pathogens. Very, very common. All of the upper sensory orifices may have that involvement. Similar pattern differentiation, acute onset, chills, fever, headache, body ache, any of these things are present. We think of exterior pathogen. What's the other major thing that plays a role with with this in every case, pretty much? Phlegm, not damp, phlegm. Phlegm, sometimes you group it under damp, but really so phlegm, various forms of phlegm. So if we're all, pretty much every time the patient has some phlegm, whether that's phlegm cold, phlegm damp, you know, phlegm heat. You know, the big differentiation we're usually trying to make is this phlegm heat or is this, you know, cold type phlegm, whether it's phlegm cold or phlegm damp. All right? Any questions?
How we distinguish the, as a physician, what is happening in the disease, disease studies?
Sinusitis? Sinusitis is basically defined, well, I think we have that's the next page here, right? So it's basically obstruction of the sinus passages, and often we'll see a rhinitis or something like this as well.
So rhinitis is also
not listed there. So, you know,
can you say common cold?
if it's external, you can say common cold, right? So if somebody has nasal obstruction, but your diagnosis is wind cold, right? And they have external symptoms, then it is common cold.
This is something that is completely foreign. For example, it's multiplexing method. How, when I want to write the diagnosis, I have to write the term that they give me as a disease. How I can term it.
If it is common cold, then write common cold. If it is not common cold, then write sinusitis or whatever it is.
Can we write that?
Yeah, as long as it's not like if you have clinically significant, just don't make any the trap for Western trained physicians, right? Mm-hmm. Somebody who's trained in Western medicine, the trap would be to make an assumption based on the Western understanding. You know, most of the time, only go with what you're given. Don't make assumptions. That's what I would say. You know, if they give you enough symptoms to say that it's a diagnosis, of course you can make that diagnosis, right? In terms of disease recognition, I wouldn't call it a diagnosis. It's a disease. It's describing what the disease is. So, you know, in this example is maybe a good example, you know, even if the patient comes in and they say, I have sinus congestion as a chief complaint, you know, we think here, right? But then we say, well, when did it start? 2 days ago, I had headache, chills, fever, body aches, right? Oh, well, this is common cold, right? But the other patterns that are listed here, you know, go beyond that, all right? One other, this is a classical TCM thing, so I've seen, maybe you have seen as well, cases of this where somebody has years-long chronic, like sometimes like a post-nasal drip, this kind of chronic, like very, very clear leaking nose. They call the leak, that should be say leaking, not laking, leaking brain, right? The leaking brain. It's a classical perspective. Yeah, you like that one? Yes. Your brain is leaking. Well, actually, in Western medicine, they will occasionally diagnose. They will find a fluid. Yeah. So. Yeah. Okay. Anyways, one other thing that I did mention in the beginning is it relates to the exterior pathogen that everybody mentioned, but we should always remember that the nose, just like the eyes, are orifices of the liver, the nose, orifice of the lung. So most of the exterior pathogens, and the phlegm pattern is related to the lung. We know that the lung is very important for phlegm recognition. So, what is the pathomechanism? What happens here with it is usually that the lung does not do its dispersing and descending function, which allows accumulation in this upper orifice. So, you know, the wind heat or wind cold obstructs the circulation of the upper jiao and the lung qi, which then builds up and accumulates this fluid in the upper part of the body, manifesting as the phlegm, nasal discharge, etc., etc. Right?
Is the obstruction of the upper jaw not Chinese?
Not what?
Not Chinese.
Sometimes it's, yeah, I mean, the congestion itself comes from inside. It's not really from attacking the Yang-Ming channel per se, but once we have this Yang-Ming obstruction, we want to treat it with Yang-Ming channels, or, Yang-Ming channels, yeah. Okay. Heat, if there's heat present, then the heat, remember, basically dries up the phlegm a little bit. It becomes more blocked and obstructed, drier, sticky, yellow, green, etc., etc. Usually, I'm just going to paraphrase a little bit of this. Usually the first thing we're thinking about, cold type will be clear or white. Heat type is yellow or green, right? This infection is usually indicating some heat presence. If the onset was related to cold, it may have transformed into heat if now the patient has heat phlegm, right? So even if the onset, patient felt chills, aversion to cold, cold temperature, was exposed to cold, right? At the onset, but now they have yellow, sticky nasal discharge with a foul smell and difficulty, and their pulse is floating and their tongue has a red tip and slightly yellow coating. Now is phlegm heat. It started as cold, the cold got trapped, combined with heat in the body, something like this, and turned into heat. Okay? Okay, major patterns: thick, turbid nasal discharge, that's what I'm describing, usually yellow, often with the foul smell. Usually the heat type tends to be more foul smell, often with loss of sense of smell, is usually wind heat accumulating in the lung at an early stage. Copious. We may have the exterior symptoms: headache, fever, cough, red tongue, yellow coat, floating, rapid pulse. Any questions on that? Typical wind heat symptoms with nasal obstruction. All right. Damp heat. All right. If we have stagnant damp heat inside, then we probably have distending, vertigo from the lack of the clear yang rising, descending pain in the forehead, so dull pressure, red tongue with a greasy coating and a wiry and slippery pulse. This looks to me like, systemic damp heat, but again, there may be some phlegm present if there's phlegm. All right. It's more common to have phlegm in this pattern. It's pretty rare to have damp heat causing sinusitis. There may be damp heat and phlegm, but the reason is because phlegm accumulates in the Yang-Ming. So if a chief complaint is sinusitis, is the pressure here, it is almost always related to the phlegm in the sinuses. So, there may be a complex pattern here with damp heat and phlegm heat, but there's almost always phlegm involved. Of course, phlegm is still categorized under dampness here. The course of the disease is usually chronic, pattern, usually related to liver or fire in the liver and gallbladder. May be accompanied with headache, blurred vision, bitter taste in the mouth, thirst, red tongue, yellow coating, not coating, and a wiry pulse. All right? No, not always.
No, it means that in the age cases, it's not cold.
It can be cold.
Can
I don't see it listed here. All these patterns listed are heat. But I'm going to say, sure, sinusitis can be cold, even though it's not listed here. Oh, here, it's coming up. right? Here. We just haven't gotten there yet. Hopefully. Well, I mean, I don't see it listed here. I'm not quite sure why, but absolutely, it could be when cold and attacking the lung. Right.
The next page.
Oh, it's on the next page. Okay. So, all right. Anyways, I'm just going to keep moving through the notes so that it's sequential here. Okay, lung 7, Li4 are some of the empirical points. For wind, especially for cold, but can be used for heat, especially Li4. Li4 is the command point for what? The head and face, right? Lung 7 is a low point which connects to Li4 and helps, any of the patterns that may have lung or exterior pattern involvement. But we also say lung 7 is the command point for the head and neck. All right. So Li4 is, really key here. Lung 7 is almost always used along with it. Low yuan combination, low point yuan point combination. Li20 I'm going to add B-tong. Usually we don't do both of these points together, but B-tong, I don't know what the extra point number is because we didn't learn that way, but B-tong is, just up from Li20 and it's a little bit better for pressure in the sinuses. Li20 is better for like runny nose and sinus, congestion of the nose specifically, the nose is blocked, but when we have the pressure and like a lot of sinus congestion here, we usually use B-tong. Yin-tong is kind of empirical for the upper sinuses, right? So sometimes the pressure headache is here. They have sinus congestion, pressure headache here. We almost always use yin-tong, or we could use UB1 as well, or something like that. Sometimes we use DO24, all right? But this, yin-tong is good for an exam. You see DO23 actually listed. We can also use DO23 and 24 work similarly for affecting this region, right? If you look up the point, one of the functions of the points is to clear the sensory orifices, meaning the eyes and nose mostly. We don't use it for the ears, but when we put a needle in here, the effect of it goes right down through the face. Yeah.
The direction.
Yeah, go down. Yeah. Other major points, we may choose lung 11 if there's what? Heat, for lung heat, right? So yin spring point of the lung. So if we have phlegm heat or wind heat attacking the lung, we want to clear lung heat. Major symptoms associated with this would be sore throat, right? Patient has sore throat, we almost always use it. Waiguan, again, this looks like a typo. W-A should be W-A-I. I don't know if that's a weird looking I or an L. Waiguan Sanjiao 5 Triple Energizer 5 to clear heat from the exterior, right? For damp heat, Li11 again we can use, and spleen 9, empirical, right? Spleen, that's what I was saying earlier about spleen 9, usage differentiation. Liver 3 and gallbladder 20 for liver heat, liver fire. You could, again, if it's liver heat, choose liver 2, all right? If it's damp heat in the liver and gallbladder, we often choose liver 3, but it doesn't matter. GB20, because its relationship to the liver, gallbladder-liver relationship, and its ability to clear the sense orifices. Clear? Good. Moving on. If there's, for chronic and long-term nasosinusitis, it may have varying degrees of results. basically the strength of the lung qi is what it's focusing on here. In general, in a very general sense, acupuncture by itself is slow to resolve and difficult to resolve chronic and systemic deficiencies. Usually herbology is better for these situations, okay? I don't know how much I agree. I still think you can possibly create change. I also would not say that spicy food is bad for all sinusitis, but not generally good for heat. Spicy food, of course, can open the orifices. I mean, you know, it has the ability, especially if it's phlegm, a cold, which we're going to get to in a second. You know, we would want to use spicy foods. This is really looking more at the heat type. Okay. Of course, smoking and alcohol should always be avoided. Cold qi attacking the lung. This is mostly exterior wind, cold, simple pathogen. What is the main formula here? Actually, this is not what I think of. Wenfei Jiu. Okay. This is kind of similar, but what's a... Oh, Sam's gone. Nobody else cares. Anybody else doing TCM herbs here? No. Okay. All right. There's another formula, Song Erzi Tong, that we usually use for wind cold causing this, which is very similar. C-A-N-G, Song Er, Z-Z-I, Tong, T-A-N-G, Song Erzi. It's just the name of an herb, actually. I would use, it's kind of similar. It's a little bit stronger than this, and it's but you know, actually you see Song Erzi here. You know, Song Erzi, like most of the herbs are quite similar. Actually, it's just more commonly used. So I'm not sure why they're using this one here.
It's not clear from here that it's wind, cold, or heat or something. I think it's external part of the body, which means that the defensive qi level, or it's in the lung part, it's qi level. We have to clear the external.
This is definitely clearing the external. I mean, I'm actually, because I don't have it based on the notes that they're providing. I don't have, because it doesn't have this listed in the pattern differentiation section, but I can go based on the formula here, it is clearing the external a little bit, all right? It is also tonifying. So this, you know, they're all, you know, off my head, that there are two patterns that we can think of. One would be wind cold attacking the exterior, causing nasal obstruction. Another pattern would be essentially lung qi deficiency, causing nasal obstruction. I mean, that's not super common. I don't see that a lot written in textbooks, but it certainly could happen. You know, especially in a case like kidney and lung kind of qi and yang deficiency. You might have that. Be a chronic, right? Okay. Spleen qi deficiency is essentially the accumulation of phlegm buildup systemically in the body due to an underlying spleen deficiency. Also adding, so the major herb formula is Shinling Baiju. This is a spleen tonifying formula. And then adding some herbs, Song Erzi, for example, Shichang Pu, that open up the sinus congestion. So again, for those of you that are not doing herbology, this is fine, this doesn't matter. But it's still useful for you to see the way that we address, we change the treatment plan and the treatment itself based on root and branch. One root, spleen qi deficiency, could manifest many different symptoms. We usually choose a similar base treatment method, or for acupuncturists, basic points that have that function, and then we add points that address the symptoms, or add, in this case, herbs that address the symptoms, which are the branch. Clear? Clear as mud? Okay. Thank you. Good.
And the treatment is where we have to address that, for example, skin sheet, skin sheet, and clear
Clear the sinuses. If you're going to change, my basic theory, my basic idea here is that if you're going to change the treatment based on it, then you should include it, right? And sometimes in diagnosis it may be something like phlegm accumulation, or so you may describe in sinusitis like phlegm accumulation or something like that. This is not very useful for you guys, by the way. There's no point to take a picture of this. You can, but there's just no point. Just saying.
There's a point for me, because some of these titles are important. I'm reading some of these books.
Okay, all right. Oops. Searching takes a little while through this one. Wow, it's really taking a long time. I knew I should use my computer. You're kidding. Try again. It must be in there. There we go. Okay. So here's a case example, right? Allergic rhinitis. Try not to show you the answer. All right? Yeah. I mean, that's like, you need to not get told the answer at this point. You're about to write an exam. If you can't do it here, problem. Let me So go ahead. Read the case, and I would like you at this point, and this is what we'll do next week, take a piece of paper, write down the disease, write down your diagnosis, write down your treatment principle, write down your treatment. Go. You have 5 minutes. If you're doing herbology, write down the herbs. I'm asking you to write it down. Don't film me. Write it down. Write down your answer. Yes, you write it down. Practice. Practice. Because you have to do this when you take the exam. Write it down. Do you have an answer? I'm going to ask you first. You have 2 more minutes left to write down your answer.
You have to read first.
Yeah.
Oh, okay.
You have to read and write. See if I can. Oh, that's fine. Next week, I'm going to put the pressure on big time.
How long time did we have in the exam at the actual exam?
I have to check. I'm not 100% sure for the PLAR, but because the PLAR is different than these guys, right? They're doing case studies. You guys are doing PLAR, which is I have to check on that one. Yeah. Just so you know, I'm going to ask each of you to read your answers out loud. So if you don't have something, be prepared to not know. I guess I should read it too, huh? Oh, great. This gets into dermatology, which is what we're doing next. Perfect. Okay. Go ahead, read us your answer. What is the disease?
Eczema.
Okay. Now here's a good question. Patient comes in, is this eczema or is it rhinitis? Right?
Say what?
She has both, eczema and rhinitis.
Oh.
Right? I mean that. Yeah. So I would list both in that case. I mean, in this situation, I would probably list both because the majority, or half of the symptoms that you're given are related to eczema as well. Okay, what's your diagnosis?
Allergy.
That's not a TCM diagnosis. What's your diagnosis? What's your TCM diagnosis? It's one part and it counts for the exam, right? This is how it's broken down, and each one is worth points. So if you don't write something for the TCM diagnosis and the TCM treatment principle, even if you choose the right points, you're only at 50%. Okay? Damp heat. Okay.
It means heat.
Damp heat. Anybody else? TCM diagnosis?
I put lung. Is that possible?
Lung heat.
Yeah.
Okay. Anybody else? Something different? Okay, you're going to say what?
Spleen.
Spleen what? Spleen is not a diagnosis. Spleen heat. Okay.
Kidney was actually like a wind cold affecting the lung.
Wind cold affecting lung.
The yin deficiency?
With yin deficiency. Okay. You haven't gone yet. What's your diagnosis?
I'm trying to think because it's confusing to me.
Kidney lung deficiency.
Something itching in the eyes. It's more heat, excess.
What did you write on your paper? Diagnosis.
I didn't write it.
Oh, okay. All right. No points.
Kidney lung deficiency.
Clearly lung deficiency, right? Okay. So nothing else to add on to that? Just lung deficiency? Kidney what?
Kidney deficiency.
Lung and kidney deficiency. Anything to add to that or just that? Okay.
Heat causing
Heat,
so to speak, let's say, summer heat.
summer heat. Okay. So just to be clear, the summer heat is yeah. It's clearly heat and it's clearly wind. So are you saying that that this is a case of wind heat? Heat yin. Okay. Just not quite sure. How would you write it down in the exam? Given this case, write down your TCM diagnosis. Pattern differentiation.
Someone got a young child.
Green pages. What's the wrong? Done.
Some monkey. Attacking young child. Causing
Okay. Next.
I had the lung, chi, and blood deficiency.
Lung blood deficiency. That's a new one for me. Lung chi and blood deficiency. You mean like systemic blood deficiency? Right.
it's chronic.
Yeah.
Obviously, patients.
Yeah. It's a good differentiating key point here. Come on. So what do you got? What's deficient?
Kidney, for sure.
Okay, kidney is deficient, so we have a kidney deficiency. What is the kidney deficient in? Ideally, you would like to say, is it Qi deficient, Yin deficient, Yang deficient? What do you mean, preliminary diagnosis?
I would think a better case history.
I think that way too when I read Machiojins, but sometimes I choose these because they're very, very popular. This textbook is from '94, it's really old, and everybody in North America loves Machioja. So I pick these not because I think they're good cases. The other cases I showed you are really excellent cases. Jiao Shu is an amazing diagnostician. I choose Machioja because this is what people get a lot of things more similar to this. Anyways, go ahead. Anything else?
On the pause, I'm guessing that kidney deficiency.
Yin deficiency. Interesting. Right? Because which side? I don't remember in my head. Yeah, so the left. Yeah, that's a good way to think about that. Kidney is a kidney Qi or Yin or Yang. Okay?
Might be from all of this.
Yeah, it's always good to go last.
Yeah, it is residual don't because it's sticky. We have a slight sticky coating there. Then an eczema that is not acute, which is from the summer. Then we have a residual back feet more than back feet. And this stir up the fluid and we have the kidney, even the kidney and the lung infections.
Okay. All right, so what is the pattern here? Well, so those of you that went earlier, I'm just going to do this again, focusing, we'll do a lot more of this next week, but if you tell me that the diagnosis is damp heat, my treatment principle is to clear heat and drain dampness. It means it's an excess condition, you haven't addressed the deficiency. If you say that this is lung heat, it's also an excess condition. My treatment principle is to clear heat from the lung. Or, I'm assuming you meant exterior heat, right? Clear wind heat from the lung, all right? So that should be indicated. If you meant exterior wind heat, then you should say wind heat attacking lung, or exterior heat attacking the lung, or something like that. Lung heat could be interior heat trapped in the lung. Maybe you meant that. Great. Okay. Either case is purely excess. There's no tonifying. Read the title of the case again. I mean, I gave you these, and the title tells you the disease and the diagnosis to some extent. But you still have to understand TCM to really write this down correctly. If you say spleen heat, all right, again, same thing. Your treatment principle, treatment plan is to, what are you going to do? What's your treatment method? To drain heat from the spleen. You're not addressing the obvious signs and symptoms of deficiency that are there. All right. This also is okay. Wind cold affecting the lung. All right, with the yin deficiency. Your treatment principle is to use acrid exterior herbs, so acrid wind cold clearing herbs, which would be, dispersed wind cold from the exterior, while nourishing the yin on the interior. All right. Okay. What about the weak kidney pulse? How do you explain that? Why aren't you treating it? Okay. What signs and symptoms of yin deficiency do you see?
Itchy throat.
Sorry?
Itchy throat.
Does that tell you this is yin deficiency?
Because
No, it's. What sign of yin deficiency do you have besides the weak pulse in the side of the kidney? Is there a need to nourish the yin?
All of it is not excess heat. It's kind of a deficiency.
Well, it's a long-term thing.
She's had it as long as she can
long-term
remember, so it was like
disease.
What signs and symptoms of yin deficiency are there?
Dryness.
Where is the empty heat?
In the skin,
Where in the skin?
in the lung part, the lung deficiency part, somewhere that.
Read it. Read where it is. Read the description of the skin. Right?
Options were not those red spots.
Where?
Eyes.
Where does that, what does that sound like to you? It sounds like malar flush. Empty heat. Okay, so, alright, good. Just so we're there. Lung and kidney deficiency. Somebody read the title, good job. No, it's good, it is good that you paid attention, because most of the mistakes that people make, the most common mistakes you will make, are by not paying attention. Tell us why.
Why? I say kidney because kidney actually gave a lot of problems in the skin. And she referred to SEMA. And
Kidney gives a lot of problems to the skin?
lung.
Lung does. Usually not kidney.
A lung. Yes, that's right. A lung, because it's a long-term thing. It's not a new one. So it has to be with congenital genes that she has.
That is key for the kidneys, yes. Right?
That's why I say the gene essence.
Yeah, the jink. As long as she can remember, she's had these symptoms. So that is part of the kidney pattern. The weak pulse in the kidney. So what is the pathomechanism here? We have a chronic kidney and Wei Qi deficiency, basically. Read the signs and symptoms again. She's not coming in with excess accumulated rhinitis. She's coming in with a chronic long-term exposure to what seems like exterior wind heat symptoms, right? Itchy, hay fever, itchy eyes, sneezing, and irritated throat. Hay fever, exposure, and this is chronic, long-term. Why? Because she has a weakness of her lung system that is rooted in the weakness of the kidney system. So actually, the signs and symptoms that she has now I don't even know what she has now. I don't like this case for that reason. But the key point being, the key point being is that as we read the case here, a 25-year-old woman had been suffering from, is that she's coming to you saying, I frequently get hay fever, right? I don't have it right now, but I frequently get it. And which means that you're primarily addressing the deficiency. If she came while she had it, you would then essentially clear wind heat, right? While she has hay fever, right? That's where you were going with this wind heat, okay?
Would you, with dryness and stuff, of eczema, is it usually also blood deficiency as well?
Yeah, that's too shallow. Yes, you're right. Eczema that manifests primarily as dryness would be considered likely related to blood deficiency, right, which may have itching, but it started red first. And so likely here the dryness and itching is the sequelae of the heat pattern, right? Rather than, there's no other signs really of blood deficiency, and that's why I say we can't in this case say that it's related. One symptom does not equal a pattern. Just keep that in mind. A pattern is a group of symptoms together, always.
So what's your
Well, I would say underlying or, chronic deficiency of kidney and lung causing, weak defensive qi. That's basically what this pattern is, which is why she gets...
So we have to go all the way to where you say causing this and that when you put it?
You have to have a rationale. You should have a rationale to how you're diagnosing and treating. Which means that if I am given this case, what I would say something like that. And I would say that because in my treatment, I would write out, right? If you don't write it, they don't know that you're thinking it. So you have to write out why you're doing that treatment, right? What treatment are you doing and why are you doing it? If you, in this case, because I'm not going to treat the wind heat symptoms and I want to explain that. So that's why in my mind, I would include it in the diagnosis, right? If they tell me that she had been suffering, but she doesn't, right? It's just, that's what this is saying. This is a chronic problem that she gets during the summer, but there's no indication that she has this now, and so I would explain that, and I would say, well, my treatment principle right now is probably 80% towards tonifying kidney and lung systems, and then maybe very minor working with the Wei Qi specifically. That's all I can say based on this. Okay, don't worry about mine. It doesn't matter what I do. Yeah. Okay. Don't ask me. Read. His answer. His case. His answer. The wind heat is when it comes, but if you look at his treatment, he's not really doing well. He used Fang Feng and Chan Tui, right? And Bai Xian Pi as our exterior. Yeah. Like I said, I don't always agree with Machiocha, but doesn't matter. Case in point, right? You guys get the idea. Okay, next case, whoops.
So what would you put in the treatment principle?
Treatment principle is what I just went through.
Oh, okay.
Okay, treatment principle for him, you see the way that he writes it. Diagnosis is this, right? Treatment is is really, this is the treatment principle, right? That's the treatment principle section, all right? The treatment, you know, is the following. Okay, he doesn't list points here, it's fine. But that, it just gives you an idea of formulation, all right? Don't be overly shy and, like, you know, being very clear. Again, connect the diagnosis and the treatment plan. Let's just do one more because it's right here. All right, case 6.3. Similar idea. I'm just going to read through it because that took too long. Okay. Seasonal rhinitis since age 22. So maybe not this kind of Jing deficiency. Sneezing, sensitive eyes, runny nose, white watery discharge, except in the morning when it was thick yellow. So what we have here, the way that I'm reading this is it's primarily a deficiency. It's more cold type, except for in the morning. All right, that could be related to yin deficiency, where there's heat at night that's drying up the phlegm and causing it, or it could be related to some kind of other irritant in that, you know, if we think practically, stagnates and it sits at night and just kind of, you know, dry, it gets worse, right? His pulse was only slightly weak and the left rear position was weaker. So again, this is probably a slight yin deficiency, but primarily this is more of a damp, like spleen deficiency, right? It says lung and kidney deficiency, but it looks like there may be some small element of spleen weakness here. Not a whole lot, but a little bit, all right? Just a minor amount. And that's the, you know, the swollen tongue. So again, seasonal rhinitis, lung and kidney deficiency, pale swollen tongue, you know, indicates that there's maybe a little spleen, qi, yang, something like that. All right? Okay. Pretty similar treatment actually, not too different, except for he's using some other herbs to tonify spleen a little bit. So if we're talking about acupuncture between the last case and this case, major points to work with the lung, we may choose lung 9, we may choose UB13 for the kidney, kidney 3, you know, something like that, UB23, tonify kidney, right? And then last case, if we were clearing wind heat at the same time, we would probably choose GB20, head symptoms maybe, or maybe we use one of these other points that we talked about earlier in this section. We may also include something like DO14 for wind heat. We use this a lot. I'm talking about the last case, not this one yet. Right? So the last case where it was more heat type, exterior wind heat. Right? And in this case, and then what are some other points that we might use? LI4, Sanjal 5, you know, these for exterior wind, head symptoms. Here, we're going to use some similar points for tonifying lung and kidney, and then add some points for tonifying spleen. All right. In this case, I don't know, maybe just spleen 3, something like that. Okay. Yeah, you could use that for wind heat. Sometimes, I mean, usually we think of LI11 as being more systemic heat. So there's a lot of heat. In the case of like phlegm heat, sinusitis, then we can use that, right? UB11 we could use for wind, exterior wind, yeah. Wind pathogen. Stomach 36, we could use for, sure, for like the deficiencies, we could add it. I steer students away from that point because that's the only point anybody knows. Of all 400 points you're supposed to know. Right? I know we use it all the time in clinic. I mean, half of our patients were like, oh yeah, you're weak, let's do stomach 36. So it's not bad for it. It's not that it's incorrect to use. It's that for learning, it's not very helpful always. In this case, you know, yeah, if there wasn't, yeah, I may use it. Yeah, I may use it for the deficiency. The other points that I would say are important or useful to remember would be stomach 40, because when we have, again, this idea of yang ming, all right, so I don't see that listed in the notes there. Yang ming is stomach and large intestine meridian, and sinusitis and obstruction, if there's phlegm present, we almost always use stomach 40. Why? Because it's on yang ming, it's a little connecting point, so it helps drain excess out, and it connects to the spleen, which is the origin of phlegm, and yeah, and it's also, you know, this is one of the most common and important points for treating phlegm in the body. So if you do have phlegm, whether it's phlegm heat or phlegm cold, especially with phlegm cold or damp, we will use it. Phlegm heat, most of the time we will use it as well. As long as there's substantial phlegm, I would think of that. Okay? Any questions so far? Let's see. Let's do the last section. Let's do one more section before lunch if we can. We only have 20 minutes, but let's maybe. I think we can knock this out, right?
Yeah.
Sure, knock it out. What is it? Sore throat, right? Right. Right. All right. Summary. Should we actually just start with the summary and use this as a template?
Well, we don't have that in our book.
We
so
don't
it's
have
not hard to
we haven't been handed out the
I'm going to ask him to give you the summaries because they're not in the books.
Every week for those summaries.
Oh yeah?
Yeah, it's not.
Interesting stuff to learn.
You should, they will pay attention more to you than to me.
Okay. All right. Okay. Very, briefly speaking, when we think of sore throat, there's a few. Again, think meridian, think organ. Right? What are the organs? Major organs. Lung. The lung internal pathway actually goes up through the throat before it emerges at lung 1, and the exterior pathogens have, they enter the lung. The lung governs the way qi. So we often think of that. However, the throat is a bottleneck of all the meridians that go to the head. So every single meridian goes through the neck, right? Which ones come through the throat, which is like the front of the neck? Well, largely stomach, large intestine, sanjiao, right? The sanjiao kind of comes up here. Am I missing something? Renmai. Yeah? I mean, gallbladder is much more posterior, usually not sore throat, is not usually associated with that. Small intestine is also more posterior, it's the Taiyang region, so not usually associated with it. Gallbladder, urinary bladder, yeah. So, these are the other meridians that we should keep in our mind. So, specifically with the stomach, you'll see the pattern related to lung also, which has to do with heat. So I don't know how deep you guys are in TCM theory, but heat entering the yang ming channel. So yang ming is stomach. Heat in the yang ming is after the exterior heat. When that heat goes inside the body, right? It attacks the organs, and even if we don't have like what a textbook definition of stomach heat is with stomach symptoms, we will often have exuberant internal heat, internal excess heat, right? high fever, a lot of thirst, a lot of sweating, and a surging rapid pulse. This is the 4 bigs, and this is what we really mean by stomach heat. And it's common in Wen-Bing theory, 4-level heat theory, that when we say heat entering the qi level, that's what we're referring to. And yes, they may have, at this point, they may have sore throat, right? Everybody familiar with 4 levels? Good. Okay. So heat's accumulated in the lung and stomach, and so in both cases, it's saying like it often steams upward, causing that inflammation in the throat. Okay, that's the theory there with the meridian relationship. The renmai and kidney meridian runs right next to the renmai, right? So conception vessel also runs right through the throat. So it's common to have sore throat, chronic, deficient type sore throat with kidney yin deficiency, chronic kidney yin deficiency, where that empty heat basically goes upwards through the renmai, irritating the throat. Okay, usually this will be worse at night. There's a lot of thirst at night. There's other yin deficient symptoms. It's often chronic, and it's no presence of acute exterior pathogen, no infection or anything like this. Often, unknown origin, and it's less severe. We don't have like huge inflamed lymph nodes or anything like this. What else? Okay. Major patterns listed here. Red, swollen, painful throat with coughing, usually with chills, fever, headache, and a floating rapid pulse, major sign for exterior heat. Excess heat in the lung and stomach with swelling, pain in the throat, combined with, so again, remember, stomach is really yangning heat, so we're combining that with interior heat, which would be constipation, yellow, scanty urine. Often there may be a fever as well. We said high fever. There may be sweating. A large surging pulse or tidal pulse is an excessive internal heat pulse. And the anything else? Red tongue with a yellow coating shows that there's heat on the interior. Again, it may be dry if there's a lot of heat. They're thirsty. If we have yin deficiency, we look at the more chronic condition. Okay, it may be slightly swollen. So sometimes patients with like thyroid problems, we see something related to this. Hyper or hypo. Usually hypothyroid relates more to a kidney yang deficiency, where hyperthyroid may be a liver condition or maybe something like a yin deficiency here. Usually there's some hypothyroid. We, remember, this is not really an education class because we have to pattern differentiate even hypothyroid, but it usually manifests more similarly to a kidney yang deficiency, and the endocrine system is closely related to the kidney system in TCM, even if there's other organ involvement. So hypothyroidism often has elements of spleen deficiency as well. It's usually this kidney yang spleen deficiency, where hyperthyroidism is often connected to a liver excess pattern. Could be like liver heat or liver stagnation, or yin deficiency of the kidneys and or liver sometimes, and actually some other organs may be involved. Like I often see like heart yin, involvement, but usually there's a kidney component there. And the way that we look at that is, remember, what is the commonality between the biomedical diagnosis and the TCM diagnosis is the signs and symptoms stay the same. So if you just look up the signs and symptoms of hypothyroidism, you say, what TCM patterns is this close to? Does this look most like hyperthyroidism? What TCM patterns does this look most like? And that's how, that's really how it's done. You have to stay connected to the signs and symptoms though, and so, in certain cases, those signs and symptoms have a broader range and it may manifest more one way than another way with any given patient. Okay, so other significant, there's often a discomfort, I wouldn't necessarily say pain, but there may be pain with swallowing, dryness of the throat, worse at night, pain with swallowing worse at night. Key, red tongue, likely, what is the coding? Yin deficient, what's the coding? What's a tongue coding for yin deficiency? No coding. Thready pulse, rapid, indicates, typical yin deficiency. Primary treatment. Okay, this first group of points here is for what? Exterior and heat clearing. Okay? Lung 7 has dual functions here, right? It is the master point of the renmi, so we can use it in yin deficiency when combined with kidney 6. But it also is useful for exterior patterns. We use it a lot for wind, heat, and cold, right? Right?
Yeah.
Yeah. So, this is an example of if they say list 4 points, man, it's a good one because it covers a lot of ground, covers more ground. And, specifically here, the lung 7 and kidney 6 is empirical for the first, or for that third pattern of yin deficient sore throat, okay?
No, that's it, sorry. Was LI.
LI, yeah, more for excess heat, okay? GB20 and Sanjal 5 added for wind heat, right? Clear the exterior wind, external gate, wind gate. Lung 5 and LI1 and stomach 44 for excess heat in the lung and stomach. Now there's a little bit of space here. So why are we using lung 5 instead of lung 10? The symptom that we're treating, the disease, is sore throat, right? Painful throat. So actually, if it's exterior wind heat, so in the first one, the first group here, not the second group, right? If it's exterior wind heat, I would say lung 10 is one of the most important points, one of the most common points. And lung 11, bleeding on lung 11, I would add to these as being very important for wind heat, causing tonsillitis, or causing sore throat, right? Painful throat. Almost like that bleeding on lung 11, venting the acute heat from the lung is very, very useful. But in the second case here, the heat is internal, it's not external anymore. So we're not trying to release the exterior. Jingwell and Ying spring points have more of an acute kind of exterior functionality to them. Lung 5, what's the nature of this? It's a hussy point, so it goes deeper to the organ. It is also, 5-element theory. What element is it? Quick, yin meridian starts with wood. It's the water point, which is the grandparent point. It has ability to, treat or control excess. Yes, we use it for phlegm a lot, but there's no phlegm present in this case. So that's not why we're using it. We're using it because the heat is now interior. Yeah, that's right. Large intestine 1, again, LI1 and lung 1 can be used similar to clear the heat. Stomach 44 is the Ying spring point for heat clearing from the Yang Ming on the stomach end of the channel. And when we have a yin deficiency, kidney 3, lung 10, which is very interesting. I wouldn't normally think of that. I wouldn't normally do lung 10 in this case. I would just stick with this group of lung 7, kidney 6, kidney 3, and then I might even add something like a Renmi point. If there's kidney weakness signs and symptoms, I'd probably add something like Ren 4 to the idea is you have to pull the fire down, the Renmi. Kidney 2 would be good. Kidney 2 you could use here as well to clear the empty heat from the kidney. Kidney 6 is the best, is most important here. Yeah, after those, yeah. Kidney 2 is good for empty heat, yeah, in the kidney. Good.
And for the weak heat, why not go with D14?
You could add DO14 as well. Yeah. You know, there's lots of variation here. That's why it's not that you have to choose the same 4 points as they do, but they would effectively be looking for correct diagnosis, followed by addressing and prioritizing root and branch, right? The cause and the manifestation of the disease. So, you know, if you're only writing down 4 points and explaining why you're choosing those 4, you know, if you replace a GB20 with DO14, that doesn't really matter. Both of them are serving the same function here. I feel like I missed something here. Okay, here. So the auricular acupuncture, you know, larynx, lung, heart, adrenal, tonsil. I would add with if it's wind heat, we may bleed the ear apex. If there's fever, it clears heat from the exterior. Okay. Okay, herbal prescription. Wu Wei Xiao Du Yin is really for toxic heat, and so if we have like strep throat, we can kind of differentiate between like wind heat with sore throat. We usually use Yin Chao Song, right? If we have toxic heat, then we can think of Wu Wei Xiao Du Yin, all right? Wu Wei Xiao Du Yin is like, you know, stronger for that infection clearing. We can also think of Qing Yang Li Ge Tang. Qing Yang Li Ge. You know, this is, you can see that has Huang Shen Huang Lian in it to drain the heat from the interior. All right, and it has the first group of herbs, and Zhizi also clears heat from the interior. And then it still has Jinyin Hua Lian Chao for the, you know, going directly to the throat. Niu Bangzi, very important for sore throat. In general, we can use that for exterior but also interior heat. And in this formula, Da Huang and Mong Xiao are being used to purge the bowels, so purging the heat downward. Remember that heat in Yangming, we call Yangming Jing and Yangming Fu. In Yangming Fu pattern, we have the constipation. We need to clear the heat downward. You know, what's the major formula that we use for Yangming Fu? Da Chen Qi, right? Da Chen Qi Tang, right? For clearing and purging the heat through the bowels. This formula uses some element of that, but then also some element focusing on the throat. Clear? Clear as mud. Good. Toxic heat. Again, what's the difference here? Okay. Major difference is there's really toxic heat and a lot of pain with this one. All right. If you look at the herbs, starting at Zhao Jiao Si, okay, this herb is often used to promote eruption. It's a big thorny kind of herb, and we use it in Waike for like unerupted pus, to promote the eruption of pus. We also have Wu Xiang Mo Yao, frankincense and myrrh, which are really more blood moving, so you can see the amount of pain here is almost like blood stagnation. And also Shanjia is for the pain. Fang Feng Chen Pi Gan Sao, mostly wind and phlegm stuff. Okay. If there's blood heat, you know, these are other possibilities, less common, but if there's blood heat, we use Shi Jiao Di Huang Tang. If there's yin level heat, we use Qing Yin Tong. Okay, clear the yin level. All right. They may, and in terms of acupuncture, the patterns that correspond with yin deficiency largely are the same that we would use. You know, I'm not saying it wouldn't change the patterns if we diagnose it as blood heat or yin level heat. We would probably look at using pericardium 6, spleen 10, Geshu, you know, major points for heat in the blood, but otherwise largely the same. Okay, because the path, the main, it's just not very common. Sore throat is not a symptom of blood heat or yin level heat usually, but blood level heat and yin level heat do damage the yin. So it is possible to have the sore throat as a kind of later progression of those heats. Okay.
We have to choose that, for example, our diagnosis based on the, for example, 4-stage, 4-level diagnosis, and for example, if you speak in the sheet in yin or blood level, or should be the organ deficiency.
Whatever's most appropriate. I mean,
Okay.
if it's organ related, usually you are choosing the organ or indicating the organ that's being affected. If it's systemic, then usually you just use the generalized diagnosis. Yeah. For case studies, you know, if you're changing your treatment to direct it towards an organ, indicate that. Okay, and then we have the Shen disturbances, which is also severe heat, you know, basically like coma, you know, I don't know why these are in this section. It's not really a major thought process with sore throat, or painful throat, but in extreme interior heat, we can go into the coma, so we use the Angong Niu Huang Wan or Zishui Dan. Okay. Again, okay, so there's looking at the abscesses, and that's why in that last condition we had, I was mentioning the Zhao Jiao Si, okay, actually promotes rupture when we have an abscess, painful abscess in the throat that's not rupture, we promote the rupture. I can touch on this a little bit more in the Waika. We talk about this a lot, which is that treatment progression from having, you know, when you have an external condition, or even in the case of the throat, sometimes these are internal, you know, whether they're carbuncles or cysts or whatever, and sometimes we want to promote the eruption to drain it and get the toxin out. And then after that, we usually need to tonify and nourish to speed up the healing process to get the body to regrow, basically. So you see here pretty basic qi and blood tonics, Huang Qi, Dong Gui, Gan Sao, and then adding Jin Yin Hua, which helps to resolve any last little toxins out and is a major herb for sore throat. Jin Yin Hua, yeah. Lian Chao also would be big. So if it's chronic, really this is in all external, not just this section, right? In all external diseases, where we have this kind of rupturing or damage to the skin, right? And it's chronic and it's not healing, right? So a chronic non-healing ulcer or something of that nature, right? That's, you know, the body is not able to close it up like it normally should. What's the normal progression? We have some kind of irritation that causes it. We get redness and inflammation. We get pus formation, right? That gets, the yang qi of our body should normally push that pus up and out through the skin. This is WICA, or dermatology principle, right? We have rupture. After rupture, shortly, it should slowly, shortly subside, right? And then your chi should heal back where it was. That is a normal progression. If we have rupture, and then it turns, it turns into an ulcer, that can't heal. We just have this chronic, maybe chronic buildup of pus, and then, it's not healing. There's not enough qi and blood. Shi Chuan Da Buwan is just a big qi and blood tonic formula. So we're just tonifying qi and blood. Same thing would be true in acupuncture. When you have chronic non-healing sores and ulcers, you would want to think about tonifying the qi and blood to, aid the body in repair, basically. Repairing tissues is what we're talking about here. Clear? Any questions?